Liver performs several crucial functions. It filters toxins from the blood, metabolizes drugs, stores energy, fights infections, and helps with digestion. This football-sized organ is incredibly resilient, with the ability to repair and regenerate itself in order to continue performing its necessary functions. Liver that is constantly working too hard can end up with liver damage. Repeated liver damage can lead to liver disease. While the liver may be able to heal itself in the early stages of disease, the damage will become progressively worse and irreversible over time. Fortunately, there are several preventative measures one can take to keep their organs healthy. Before jumping into the stages of liver disease, let's discuss about the causes of liver disease. Liver disease refers to any condition that negatively impacts your liver. There are more than 100 different types of liver disease. Likewise, there are a variety of factors that can lead to liver disease. Common causes of liver disease include viral infections such as hepatitis B and C, genetics, underlying autoimmune disease, alcohol abuse, obesity, poor diet or lifestyle, certain drugs, medications, and chemicals. Stages of liver disease. Liver damage typically has four stages, beginning with inflammation and progressing all the way to end-stage liver disease. Stage 1. Inflammation. In the early stages of liver disease, the liver will become swollen or inflamed as the body's natural response to injury. Liver inflammation or hepatitis can also occur when there are more toxins in the blood than the liver is able to manage. The earlier the diagnosis, the better. This is especially important because the liver is able to repair itself in the early stages of disease. However, many people do not experience symptoms during the first stage of liver disease and are unaware of the damage as a result. Stage 2. Fibrosis. Untreated inflammation leads to scarring of the liver or fibrosis. This hinders the liver's abilities as it can restrict blood flow through the organ. Once healthy liver cells are replaced by scar tissue, those parts of liver cannot be repaired on its own. If detected early enough, fibrosis is still treatable. Because this stage is still mild to moderate, many people will still not experience symptoms. Stage 3. Cirrhosis. Cirrhosis refers to severe, irreversible scarring of the liver. There can be several years, decades even between the second and third stages of liver disease, so act early if you have any reason to suspect you are at risk. During this stage of disease, symptoms become more noticeable. Pain and discomfort, fatigue, appetite loss, fluid retention, jaundice, and an itchy feeling around the liver. Those with cirrhosis are also more susceptible to developing liver cancer. Stage 4. Liver failure. When the liver stops functioning altogether, this refers to liver failure, which is the final stage of disease. At this stage, the liver cannot be repaired on its own or with treatment. A liver transplant is the only option for recovery. Liver failure can be acute or chronic. Acute liver failure happens quickly within 48 hours, generally as a reaction to toxicity or a drug overdose. Chronic liver failure, on the other hand, happens gradually over time as the liver progresses through each of the four stages. Symptoms of liver failure include diarrhea, weight loss, appetite loss, confusion, and disorientation. A very common question that everyone asks that when to seek medical attention. Acute liver failure is always a medical emergency. If you are experiencing symptoms consistent with acute liver failure, seek medical attention immediately. These symptoms include tiredness or sleepiness, confusion or disorientation, jaundice, abdominal pain or abdominal swelling, nausea or vomiting, malaise or feeling unwell. Chronic liver failure can sometimes be a medical emergency, especially in cases where you develop confusion, you have internal bleeding, or swelling becomes severe. If you are finding this information useful, please hit the like button, subscribe, and turn all notifications on to stay updated for my latest health and nutrition tips. Diagnosis of liver issues. To diagnose liver issues, a doctor will start by taking your medical history and performing a physical examination. Afterward, they may perform a variety of additional tests including liver function test, other blood test, imaging test, or biopsy. Liver function test. Liver function test assess the levels of various proteins and enzymes in your blood. These proteins and enzymes can indicate how well your liver functions. Other blood test. The doctor may also perform a complete blood count or test for conditions that can cause liver damage, such as viral hepatitis or genetic conditions. Imaging test. Imaging technology such as an ultrasound, a CT scan, or an MRI can help the doctor visualize your liver. Biopsy. Taking a tissue sample from your liver can help the doctor see if scar tissue is present. The sample can also help them identify what may be causing your condition. Treatment for liver issues. Various treatments are available for liver damage, disease, and failure. Number 1. Medications. Antiviral medications can treat a viral hepatitis infection, and immune suppressing medications can treat autoimmune hepatitis. Number 2. Lifestyle changes. The doctor may recommend lifestyle changes as part of your treatment. These changes can include abstaining from alcohol, losing weight if you have overweight, avoiding certain medications. Acute liver failure treatment. Acute liver failure is often treated in a hospital's intensive care unit. You will receive supportive care to help stabilize your condition and help you manage any complications during treatment and recovery. If a healthcare professional suspects a medication overdose or reaction, they may give you drugs to reverse the effect. A doctor may also recommend a liver transplant for some people with acute liver failure. Can liver damage be reversed? According to advocacy group American Liver Foundation, damage from the inflammation and fibrosis stages of liver failure may be reversed and healed over time if properly identified and treated early. The liver damage caused by cirrhosis is often not reversible, although it can be slowed or stopped. If you have end-stage liver disease, you may require a liver transplant. During a transplant, a surgeon removes the diseased liver and replaces it with the liver from the healthy donor. Tips for healthy liver. You can help prevent liver damage, disease, and failure by making lifestyle changes that keep your liver healthy and happy. Here are some tips for improving liver health. Number 1. Avoid alcohol and never mix medications with alcohol. Number 2. Take medications only when needed and carefully follow any dosing instructions. Number 3. Consult a doctor before mixing medications. Number 4. Maintain a moderate weight. There is a connection between obesity and fatty liver disease. Number 5. Get vaccinated against hepatitis A and hepatitis B. Outlook for people with liver issues. If you are in the early stages of liver damage or disease, you can often heal over time with proper treatment and lifestyle changes. However, the later stages are not reversible and sometimes require a liver transplant. Liver failure can be a life-threatening emergency that requires prompt medical intervention, regardless of whether it's acute or chronic. People diagnosed with liver disease are often monitored through their lives to ensure that their condition is not worsening or causing further liver damage. If you have concerns about liver health or liver failure, talk with the doctor. Just a quick reminder, this video is for educational purposes only, so do speak to your doctor if you have any genuine medical concerns. So it was all about my today's video. Thank you so much for watching. A like is always appreciated, and remember to subscribe and tap the bell for more healthy videos. And as always, I wish you great health, wealth and happiness. I'll be back with a great video next time. Until that, take care of yourself and bye bye.